raise hand feature now. All right, it looks like we have Zainab would like to speak, so I'm going to go ahead. Actually, yeah, so I'm going to go ahead and allow you to talk. Go ahead, Zainab.
Hi, my name is Zainab Alidina. I'm a resident of Beaverton and a doctoral student in public health. I'm also a board member of Healthcare for All Oregon, a statewide organization working for advancing the cause of universal healthcare. I'm here to talk about the access of healthcare being a human right. I'm here because HRAC promotes integration of human rights values and principles throughout the Beaverton community. I strongly believe that all people should have access to affordable healthcare as a right. Access to healthcare needs to be one of those rights for our community, and I'm here to ask the help of this commission to make it a reality. In 2012, the United Nations passed a resolution on which the United Nations passed a resolution on which the United States is a signer, reaffirming the right of every human being to enjoy the enjoyment of the highest attainable standard of physical and mental health and medical care. Access to affordable healthcare is essential for a society to function at its best. This pandemic has shown us just how interlinked each community member's health is with each other's. And multiple studies have shown that access to healthcare creates better health outcomes. We could reduce much of the health disparities we currently see in Beaverton by making sure everybody has access to the healthcare they need. In this time, we need to end the discriminatory system and relieve both patients and providers of the many burdens and related stresses that leave our residents constantly wondering about their right to the care that they need. Nobody in this community should have to make the impossible choice of paying their rent and getting their prescription that they need. Thousands of Oregonians have lost their jobs in the past year and cannot afford basic necessities. Many of those who lost their jobs also lost their health insurance that was linked to their employment. Around 12 million Americans lost their employer-based health insurance during the pandemic. In Oregon, 50,000 Oregonians lost their health insurance in the first 4 months of the pandemic. The pandemic has shown us that we cannot rely on employment-based health insurance anymore. We need a better system, one where people are not penalized for being unable to afford skyrocketing healthcare costs. Oregon is leading the way for the rest of the country through the work of the Joint Task Force on Universal Healthcare, which was created by the Oregon legislature and is charged with designing a universal healthcare system for Oregon. Oregon could be the state where people do not have to suffer or die because they were unable to afford healthcare. Hopefully, the country will follow and join other nations in the world that provide healthcare for all. In addition, with the passing of SJR 12, Oregon voters will have the chance in November of 2022 to amend the Oregon Constitution to clearly affirm that access to healthcare is a right. Several cities in Oregon have passed resolutions in support of universal healthcare and healthcare as a fundamental right. In July, the city of Salem passed a resolution where it declared that healthcare was a fundamental right. It expresses enthusiastic support for a state-based universal healthcare system. It also strongly urged the Oregon legislature and governor to work to establish a universal high-quality healthcare system that is accessible to all residents of Oregon. And so, since HRAC serves in an advisory capacity to the city on strategies that strengthen human rights, we ask that you support our efforts to make access to healthcare a right and create a universal healthcare system in Oregon and in the nation by requesting that the Beaverton City Council pass a similar resolution to help Oregon lead the way in making healthcare a human right. If you wish, we're prepared to return for a future HRAC meeting to engage with you in a deeper discussion on the need to create a universal healthcare system and why healthcare is a human right. Thank you.
I have a question for Alidina. Could you say your name for me?
My name is Zainab. My last name is Alidina.
Oh, I'm sorry. Could you say it again for me?
Zainab.
Zainab, thank you.
Mm-hmm. Yeah.
So what do you think? I mean, as far as, certainly you're suggesting that we talk with council about supporting legislation around that. Is this part of a formal organization that it has some legislation that is before the legislature, or can you give us a little bit more about what that support might look like?
Yes, absolutely. So SGR 12 was passed in the last session, and it is now going to be a ballot measure coming up in 2022 in November, where all Oregonians will vote whether they want to change the constitution and add that, affordable healthcare is supposed to be a right in Oregon for all Oregonians. And so what we want is cities across Oregon really to show their support for this measure, the measure, and just affirm that they actually do believe that healthcare is a human right. And
Thank
yes,
you
there
for
is
explaining
a, sorry,
that to
and
us.
yes, there is a organization, Healthcare for All Oregon is a 501c3 nonprofit. I am a board member of it, but I'm also a resident of Beaverton, and I do think Beaverton should be pushing for this.
Great. Lisa, I think you had your hand up.
Zainab answered my question. I just wanted to clarify how we could support her, and sounds like advocating to the council to make a statement would be ideal.
We really appreciate your time in coming today, Zainab.
Thank you. Yeah, I think Nadia also has a comment. Yeah.
Oh, I think Cameron had a comment. I'm sorry. I think I saw your hand up.
Just in the interest of full disclosure to everybody, Zainab is my wife.
Yes,
So,
also
yes.
that.
Just
Lucky for you.
yes, didn't want to.
Councillor
Sorry,
Hassan has a question.
Oh, just a comment. I do want to say I was watching Cameron. You could tell there was something there. Thank you for your public comment. I do want to, someone reached out to me from Health Share Oregon, and I'm supposed to have a meeting with them on Friday. So there's two ways I think that this committee could take this. One, y'all could bring it on your behalf via Zainab, our resident, and then try to get it in front of City Council. And alternatively, we can just see what City Council wants. So both avenues I think are really great. And I could tell you, knowing where I think most of council lies, like I would imagine that this is something that would get support. So I'm happy to support however I can, but I do have I have a meeting with someone on Friday.
Excellent. I'm so glad that you brought this to our attention, Zainab. That's
Well, thank you for the
very
time.
helpful.
Yes, and thank you for your time.
Thank you.